For over 7 decades, Tanner Health has been serving our community. We started with humble beginnings as Tanner Memorial Hospital, built by the community for the community.
You know, the origins of Tanner as a community hospital are rich and rewarding. It's really remarkable when you look at the history of healthcare in our region. Prior to the hospital, you had stories of physicians, literally doing procedures on kitchen tables and making house calls. And it was well into the 1940s before you really saw any kind of organized healthcare from the standpoint of the Carrollton Clinic coming about. Our start as a community hospital really was community-based, and it started with Mr. C.M. Tanner challenging the community with a $75,000 contribution and asking the community to support the hospital and the creation of the first hospital in Carroll County in the West Georgia region.
I think he started the hospital because he knew Carroll County had a need for health care. And with his father being one of the first doctors, I just think that was on his mind to get done before he died.
Another major contributor to that success was Mr. Roy Richards. He had a budding wire company, and he realized that if he was going to attract the talent and keep his organization growing, he needed to have quality health care.
So the truth is, whether it's children or industrialists or business people or just citizens of the community, this community has always recognized the need for quality health care.
They literally went down neighborhoods with wheelbarrows, asking people to put in pennies and dimes. I think that's what makes Tanner special. Its start from the very beginning was the idea that a community to thrive and grow needed a community hospital.
Today, we're redefining care with 5 hospitals and more than 50 outpatient locations throughout West Georgia and East Alabama, staffed by over 700 providers and more than 4,500 team members. Our team members are your friends and neighbors, making an impact where we live.
Well, my connections professionally with Tanner Health goes back to 1968, which, if you say that real fast, I think is 56 years. In the original old building of 1948, the operating room, very often the air conditioning didn't work. And you can imagine with gowns and everything on and the bright light shining above, had absolutely no air coming in. So we had to open the windows. It was either that or having the doctor's plane or something or other.
Well, I remember the days where we didn't have adequate health care. I remember the days where doctors on call did all the work. And I remember the days where the surgeon put on casts, did all the orthopedic.
In those days, whoever was in the community, and family doctors for most of them, did everything. They had to cover the emergency room, obstetrics. We rotated call. And so in my first 15 years, I worked 80 hours a week.
If you had a major operation, you'd have to go to Atlanta. That was quite a trip at that time. It was a 2-lane road, and that was quite a chore. Became very apparent to citizens of the West Georgia area and Villa Rica, we needed the local hospital.
I grew up here in Carrollton. We moved to Carrollton as a family when I was 6 or 7 years old. My dad was a physician on staff here. He retired at almost 80. So when I went to medical school and did my residency training, there wasn't an infectious diseases doctor here. So it was a perfect opportunity to come back. And so I have been a physician at Tanner since 2004. And it's been very, very gratifying to be part of that.
For over 75 years, Tanner Health has evolved from a small-town hospital into a world-class health system.
When you're in a health crisis, moments matter. That's why it's so important to have a local hospital like Tanner, East Alabama.
Higgins could not survive as a small, standalone hospital. We had to do something to keep our hospital alive. Tanner made it perfectly clear from the very beginning that they were there as a partner, not as a big takeover.
I think we have a very personal connection to our community because it's not big, and not a day goes on at work that I take care of someone that is related to someone, or I heard so-and-so told me to come see you because you took care of this. There's almost always a connection. We're small enough to have that, but we're big enough to provide really expansive care.
The residents of East Alabama are my family and friends, and I feel like they deserve the best health care. Tanner's been such an asset in helping provide that over the years.
Our decisions have not been outsourced to New York or Nashville or North Carolina, and that is wonderful as we think about building services to the community for the benefit of the community.
Tanner Health is redefining care for our neighbors by offering safe, efficient, high-quality health care and preventative health education for our community. Tanner Health features state-of-the-art centers for cancer care, heart and vascular health, orthopedic and spine care, as well as comprehensive women's and NICU services.
Our program at Tanner Health has evolved over the last few decades. It started out with general cardiology, including consultative services in hospital care and office care. It's now evolved to a completely different level. We're able to offer services that includes basic heart catheterization, angioplasty, stenting, taking care of patients with acute heart attacks, taking care of patients with shock with special devices. It also involves open heart surgery. In addition, we've evolved over the years with non-invasive imaging, CT scans, MR, and other new technologies. We believe our program could be matched against any program in the country. We have a strong emphasis on quality, appropriateness of care, and outcomes, and we constantly monitor that. Both of our centers in Billerica and Carrollton are chest pain certified by the National Association.
I've been at Tanner for nearly 26 years. When I first came, I was in a small room in the previous radiation center. We had 3 exam rooms and probably saw 4 or 5 patients each half day. Certainly it was not extremely busy, and we had pretty meager surroundings at that time. But since then, we've grown to 4 medical oncologists, 2 full-time radiation oncologists, and a much larger brand new radiation center, along with a brand spanking new infusion center to provide the care we need for our community. We have a fast track program, which is basically for patients who have potential diagnoses of cancer but do not yet have a pathological diagnosis. With that, we're able to work them up quickly and help them get to a diagnosis much more quickly than would usually happen. With the 3-day program, that was originally designed for patients with a diagnosis of cancer. And in that case, we would work them up quickly, stage them, and be able to offer treatment recommendations within 3 days of their diagnosis.
The approach to cancer care at Tanner is truly multifaceted. We have a strong collaborative approach amongst all the specialties. We've also invested heavily in technology that is used to improve outcomes, but also enhance safety. Just as important is our commitment to improving efficiencies. Time from diagnosis of cancer to the initiation of treatment is actually prognostic for outcomes. And so by reducing that time from diagnosis to treatment, we can improve patients' chances of being cured of their cancer.
Tanner Health is proud to offer locations for outpatient comprehensive women's health with 2 practices in Carrollton, the Tanner Health Care for Women practice, as well as Carrollton Obstetrics and Gynecology practice. Tanner Health Care for Women also has a location in Billerica, and we have most recently began offering care in Wadalley at the East Alabama location. Our goal is to provide comprehensive women's health care in all stages of their life. I get this question a lot, how many babies I've delivered, and the truth is I really have no idea at this point in my life. Thousands? Probably at least 3,000. Every time it's still thrilling. It is still a highlight to be able to be there. Within our hospitals, we have comprehensive labor and delivery available in both Carrollton and Billerica. we made the decision to move towards providing NICU services here in our community. And that has been a highlight of my career, to be able to keep those moms who may be having complications right here at home where they have their loved ones and their support, to not have to take them an hour or 2 hours away, and to be able to provide for those most precious little ones right here at home. We get to see miracles happen on a regular basis, and that never gets old.
As we think about the aging of America, orthopedics is so important to our community. And we have brought online a state-of-the-art ambulatory surgery center for orthopedics. In another way that we are bringing access to highly specialized services, we have a neurosurgery group who is providing 24/7, 365 days call and services to our community. And we continue to invest in our surgical services programs, both in Carrollton here in Villa Rica. And in Villa Rica, we recently launched a complex spine program. We offer the Mako robots for complex joints and replacements here in Carrollton. And with the intuitive robot, we now offer general surgery, urology surgery, GYN surgery. So we bring high quality, state-of-the-art, and a lower cost solution to our community.
Whether it's urgent care, primary or specialty care, or outpatient testing and imaging, we're making it easier for patients and their families by keeping care close to home. As our community grows, we'll continue to grow to better support the region and people that trust us with their care.
One of the things that I think is most exciting is our ability to bring the most advanced technology to our community. We're seeing significant advances where patients are really able to get diagnosed faster. They're able to get taken care of, surgery less invasive. There's medication regimens that have less after effects, that I think the advances coming are going to save lives. Our commitment at Tanner Health is to bring those advancements as quickly as possible to our community.
I think we've come a long way. I think we've really evolved over the last 2-3 decades, but I think that's not our ultimate stop. I think we need to go further, add more services, and really continue to strive for a better future.
This organization is stable and thriving. It is a launching pad for future investment in our community. So we will be building beds, we will be adding new services to our community, adding ambulatory sites of care, new primary care clinics, new specialty clinics in our surrounding region. And as we look out into the future, we are optimized to bring high quality, state-of-the-art, accessible specialty and primary care services to our community.
As we enter a new era in healthcare, Tanner Health is grateful for the support that we've received.
About a week ago, a lady comes up and introduces herself and tells me that her daughter that I delivered was about to get her PhD from Yale in a month or so. Now, that kind of thing is just, heartwarming to me. I mean, one of the goals that I've always had in the practice of medicine was trying to make a difference. That's a good thought for each of us to have every day, even now, is help somebody today.
Our commitment to our community remains the same as it was 75 years ago: to deliver safe, efficient, high-quality health care to our family, friends, and neighbors.
We have beautiful facilities at Tanner, and we have, well over 700 physicians and almost 5,000 employees across the Tanner system. And while we're very proud of those great facilities and all those team members, we're still neighbors taking care of neighbors. And I think that's the essence of a successful community hospital.
Even though Tanner, the community of Carrollton, is not where I grew up, it's a place where I feel like it's home because I feel like I have had more effect here than I had anywhere else in my career. To be part of this is very special, and Tanner means a lot to me. It really does.
I'm proud to have been here and seen it grown for other people's benefit.
It makes me and my family feel very proud that we have a hospital right here in our backyard that we can go to at any time for any need, health care related.
It's been a great privilege to be part of Tanner. to be part of this journey. I do believe that there's more to come.
It's hard to fathom when I think back to a little single-story hospital, and now when I look at Tanner here in Carrollton and Villa Rica and Bremen, Willowbrook, Wedowee, I think we can anticipate continued growth.
We are blessed that we have thrived. And I think the main reason that we've been successful for 75 years, it is the people. They come to a community hospital because they feel they can make a difference. And they have made a difference. Their efforts has resulted in 75 years for Tanner Health, and that's remarkable. We look forward to another 75 years, and I think it's possible because of the continued support of the Tanner team members.
Tanner Health, your care redefined.